everyone, welcome to my YouTube channel. I am going to upload the whole syllabus of anatomy including upper limb, lower limb, thorax, abdomen, pelvis as well as CNS. I have already started with the lower limb session. Our today's topic is hip joint. It is one of the important topic. It comes in university exam for 10 marks. Let's begin. It is a ball and socket variety of synovial joint. Articular surfaces. Head of the femur articulates with the acetabulum of the hip bone to form the hip joint. Head of the femur forms more than a half of sphere covered with the hyaline cartilage except at the fovea capitis. Except the fovea capitis, it is covered with the hyaline cartilage. Acetabulum presents a horseshoe-shaped lunate articular surface, acetabular notch and acetabular fossa. It is an horseshoe-shaped lunate surface, acetabular fossa and acetabular notch. Hip joint have high degree of stability as well as mobility. Stability or strength depends upon depth of acetabulum and narrowing of its mouth by acetabular labrum, tension and strength of the ligament, strength of the surrounding muscles, length and obliquity of neck of femur and atmospheric pressure. We have number of ligaments which supports the hip joint, that is fibrous capsule, iliofemoral ligament, pubofemoral ligament, ischiofemoral ligament, ligament of head of femur, acetabular labrum, transverse acetabular ligament. We will be seeing these ligaments one by one. Fibrous capsule, it is attached to the hip bone to acetabular labrum including the transverse acetabular ligament and to the bone above and behind the acetabulum and on the femur to intratrochanteric line in front and 1 cm medial to intratrochanteric crest behind. Anterior-superiorly, capsule is thick and firmly attached. Posterior-inferiorly, capsule is thin and loosely attached to the bone. Capsule is formed by two types of fibers, outer longitudinal, inner circular fibers called as zona orbicularis. Iliofemoral ligament, it is found between the ilium and the femur. It is also called as ligament of Bigelow. It is inverted Y-shaped, lies anteriorly, strongest ligament in the body, prevents the trunk from falling backward in standing posture. Triangular in shape. Pubofemoral ligament supports the joint inferior-medially. It is triangular in shape. It is attached to the iliopubic eminence, obturator crest, obturator membrane. Inferiorly, merge with the capsule and lower band of iliofemoral ligament. Ischiofemoral ligament, which is found between ischium and femur. It covers the joint posteriorly. Fibers are twisted, extend from ischium to acetabulum. Fifth ligament is ligament of head of femur or round ligament. It is flat and triangular ligament. Apex is attached to the fovea capitis. Base is attached to the transverse ligament and margins of acetabular notch. Acetabular labrum, it is fibrocartilaginous rim attached to the margins of acetabulum. Transverse ligament of acetabulum, part of acetabular labrum which bridges the acetabular notch. Now we will see the relations. Anteriorly it has tendon of iliopsoas which is separated by a bursa from femoral vein, femoral artery and femoral nerve. Posteriorly there is tendon of obturator externus, quadratus femoris, obturator internus with two gemelli, sciatic nerve and piriformis as well as gluteus maximus muscle. In superior relation there is reflected head of rectus femoris, gluteus maximus, gluteus medius and gluteus minimus. Inferiorly there is pectineus, obturator externus, gracilis, adductor longus, adductor brevis, adductor magnus and hamstring muscles. Blood supply, it is supplied by obturator artery, two circumflex femoral artery, two gluteal arteries. Medial and lateral circumflex arteries form an arterial circle around the capsular attachment on the neck of the femur. Retinacular arteries arise from this circle and supply the intracapsular part of the neck and greater part of the head of femur. Nerve supply. Hip joint is supplied by 4 nerves. Femoral nerve through the nerve to rectus femoris, anterior division of obturator nerve, nerve to the chordatus femoris and superior gluteal nerve. Movements of the hip joint. Flexion and extension occur around the transverse axis. Adduction and abduction occurs around the anterior posterior axis. Medial and lateral rotation occurs on the vertical axis. Circumduction is a combination of the foregoing movements. This was about the hip joint. I hope you understood the topic. If there is any query, let me know in the comment section. And if you want such more videos, subscribe to my channel and follow me.